Well, deciding whether or not to get joint replacement surgery can be a pretty scary process for all those involved. And here to help is one of our East Cooper Medical Center experts, Dr. Shutte. I love your name. I told you that earlier.
Thanks.
Thanks for joining us. And you were just explaining to me that we're talking mostly about knee and hip replacements as far as joint replacements.
Correct. There are a number of people having shoulder replacements, but by far the majority are hip and knee replacements, which now number in the hundreds of thousands and expected to be over 1 million a year in the United States. It's an increasingly common procedure for people of a much broader age range than we used to think possible. It used to be that somebody needed to be over 65, but now we have patients, even rarely, some in their 30s and even in their 20s, who a hip or a knee replacement is the best option to restore them to a more active lifestyle. What
are we doing to ourselves that we need new knees and new hips and new shoulders?
Well, I think part of it is just the activities of daily life, but some of it is that the ability to get somebody back to their normal activities has improved. So instead of people living a lifetime limping around or with a cane or a walker, you can offer a procedure that, if done well and with the right implant, can last them for quite a while.
All right, so if I'm signing up for one of these things, what are we talking about as far as recovery time? Because it sounds pretty intrusive.
Well, you're pretty fit, so your recovery is probably a little bit less than some.
I look fit.
Well, but it basically, a lot of it depends on how you come into the surgery,
right,
how healthy you are before the surgery. Usually it takes about 6 weeks for the bone to grow into the implant. A lot of the implants we use now don't have to require cement, so you still have that time period for the bone to grow in and the soft tissues to heal. But the hope is that people can be home within 2 to 3 days, occasionally 1 day, and then have a limited activity for a few weeks, but then be back to full speed and even more active than they were before the procedure.
Good to know. Yeah. Del, good to meet you.
Nice
I hope I don't need you anytime soon, but it's nice to know you're there, and thank you so much for the information. If you'd like some more information, go to abcnews4.com/experts, and here's some more info.
The preceding segment was brought to you by East Cooper Medical Center.